Hello, Tom Lavecchia here with the latest weekly edition of Male Plastic Surgery Topics with Dr. Douglas S. Steinbrech. Dr. Steinbrech, welcome back to the weekly live. How you doing today?
I'm doing fantastic. Great day and a little bit in the OR, but mostly seeing new consults all day long and some great, super excited about post-ops from New York, Chicago, and just back from Los Angeles. So I saw all my post-ops from a week out. They look some really good body banking going on. Really
Yeah,
cool.
actually, before we jump in, today's topic is going to be gynecomastia and male breast reduction. If you get any questions in the chat, we'll obviously field them. We'll focus a little bit on that. But before we get to that, Doc, how was the LA trip? What did you see? Any trends? Any new things going on? What was cooking there?
Yeah, just a lot more. I mean, it's all body stuff, but a lot more banking, chest, shoulders, and traps. Going a little bit farther out with the traps. The guys really love them. I just want to make sure that they look nice and natural. Traps always, that's what sets us apart from, typical liposuction. People come in and have liposuction and just sort of carve it out and then toss it. But when they come in, man, and they see these nice rounded boulder shoulders, and these traps that are just popping in this beautiful cleavage, it is a game changer. I had one gentleman who was a doctor. We see a lot. For whatever reason, we operate on a lot of doctors. We actually ran the numbers. And last year, we were up to like 380 something physicians. This is a NICU doctor in LA. And we did body banking for him. And he's a very young 72-year-old man, but still had a lot of good muscle, but he had some fat. And he had really droopy chest, droopy skin around the belly. So we did a torso tuck, did a chest lift, took all that fat, put it in his any fat that's left over, put it in his chest, shoulders, his gut, or his butt, and his traps. And the guy, 72 years old, has this body, the shape, the physique that we recreated that is more like somebody in their 20s or 30s. I mean, I was shocked. So really happy about that. I'm gonna get him on the show. We're gonna get his DNAs on as soon as we can get those.
So I want to thank those that are tuning in. So first, obviously, one-on-one is always a stalwart. Jason, thank you for being here. Xerxes, now this is a good one. Which is better, body banking or muscle implants?
Yeah, they're both great, but it depends on what you have, and it depends what you want to do. So, less invasive. If you have enough fat, and we can put those into those areas, then that's an excellent option. The problem is a lot of these guys, my guys that come in, these are the main offenders. In New York, the guys that come in for Chelsea, no fat. In LA, the guys that come in from WeHo, no fat. In Chicago, the guys that come in from Halstead, no fat. But then a lot of other fitness guys, I don't care, which way you swing. It's guys who are really fit that have no fat, but they hit a genetic barrier and they want more size. Maybe big shoulders, want a bigger bicep. I did one guy who was totally lean, and I've already done his biceps and his shoulders. Came back 2 weeks ago, did his forearms, his triceps, and his pecs. He looks like an Adonis, but he had absolutely no fat to be able to put to bank, and he looks just phenomenal.
All right. I'm going to ask you this question, and I'm going to probably use it as a soundbite because the number one thing we hear on response to your stuff is just go to the gym. Just go to the gym. Talk a little bit about the genetic wall and why we're not all beautiful people genetically.
Listen, this plastic surgery practice is made for people that go to the gym, people that want to be fit, people that want to be healthy. Period. That's our group, or people that have lost a lot of weight, a lot of massive weight loss, fleur-de-lis, torso tucks, chest lifts, face lifts. We're not operating on people that don't want to go to the gym. We're not operating on people that are trying to avoid going to the gym. These are all people that are basically very fit that just want to, they hit a genetic barrier in some area, like we always talk about. They hit a genetic wall. Maybe they have, and this happens in mesomorphs, which is sort of typical sort of bodybuilders, amazing shoulders, amazing traps. But look at them. A lot of times they fail to get as much size of their chest, even with steroids, that you would expect them to have. Conversely, an ectomorph like me, a skinny guy, kind of a scrawny guy by nature, I go to the gym, but I can, an ectomorph surprisingly can get a pretty decent chest, but then have a real challenge with the biceps, the triceps, and the shoulders. So, and also with the calves. So, and I can even get guys that didn't skip leg day. We talked about calf implants a couple of weeks ago. Guys that do not skip leg day, they have a huge butt, very muscular, great, great quads, and then just lacking calf development. They're putting in extra time at the gym and they're not getting it. It's the way their body was naturally developed. It's about the length of their muscle head, the head of the muscle, or the length of the muscle belly, and resorts and them having a challenge with their calves per se. So what we do is we go in and help those people. And then the other thing is people that have had injuries. A lot of bodybuilders that are wearing away the central portion of their pecs. We can put in a pec implant, do body banking into that. Or people that guys have gyno. They go to the gym all the time. They have everybody's done around and steroids here, their growth hormone has a little bit of gyno that needs to be taken out, which leads us to tonight's episode.
Yeah, and I think a great question. I've done testosterone therapy in the past. I've noticed, beautiful children, by the way, Jason. I've noticed my lower chest has been sagging, and there seems to be space between my chest muscles and nipples.
Yeah, and that happens a lot because after you do a couple rounds of steroids, you can get some gyno tissue in there, and it can physically stretch out the tissues. And then after you stop doing it, the gyno is still there, but the muscle mass has gone down a little bit. And the fact that you opened up the tissue envelope, the skin envelope, by putting on that weight, you can have a little bit of deflation there, and you can actually have a break between that. And now your lower chest is sagging a little bit because of the weight of the gynecomastia. It's very common that we see that, but we do have ways to address it.
Okay, Xerxes again. Lovely photo. Will the body banking fat ever melt and leave you uneven and or even deformed?
No, because but the cells really go in evenly. When I put it in, I put the cells in very evenly, and I even make sure that the concentrations from side to side are equal. We have a numbering system to make sure equal amounts of fat go in. And post-operatively, I really, for 28 days, because after 28 days, whatever cells don't survive after that don't survive. And so we're very even. Patients are very even. And it's mostly based on really systemic factors that are going to be involved in whether or not the cells stick around. And typically, the most common, it can be by age. Younger people, more fat cells survive. The second one is the place where we put it. For instance, the shoulders and the traps and the butt, amazing blood supply. More fat sticks around there than anywhere else. Chest maybe a little bit less, and then the calves, the biceps even a little bit less than that. We're talking about 85% dropping to 75%, dropping to 65%, like that. So how hospitable the environment. I say one area might be the desert, the other might be the tropical forest, to give you an analogy. But then the third factor is the most important, is nutrition and carbohydrates preoperatively, building nice pre-nutritionized fat cells that are going to survive their path to the new area, but also how well you take the stresses of surgery post-operatively in terms of nutrition. Now, I'll tell you, the people that climb in, that buy in, that turn off the brain, open their mouth, and shovel down the carbs post-operatively get a much better result. More of the cells survive, and they have a better body banking result. The people that don't, they're people like, I want to go on a cruise, or I want my abs to be ripped. It's July. I want to look great at the beach. Those people lose because they are in negative, they're in a catabolic starvation mode as they're trying to heal up. So your body's putting up so many calories, really a New York Marathon every day, just sitting still. And this last priority is to have these cells stick around. The people that win are the people that load up the carbs. They have more than enough carbs to heal, to run the factory and run your immune system and run the healing. But they have excess calories to be able to keep the cells in place. Those are the people that win just for 28 days. Then you can go on a paleo diet, a keto diet. You can get down so your abs are ripped, but those cells will stay with you. They will not melt away. Those cells will stay with you for the rest of your life.
Well, I do a little shameless plug. That's kind of where you have a post-op formula, a kind of a whey protein. Is that kind of fit into that regimen as well?
Yeah, because I just wasn't. I knew that we needed more carbs, and I was finding every time I talked about a calorie or a gainer drink, people would go right to a protein drink.
Correct.
And we do need protein. We do want protein. That builds it. But what's going to make the cells stick around? Fat doesn't make fat. Protein doesn't make fat. What makes fat? Carbs. Carbs make fat. Fat doesn't make fat, because when you want to burn fat, what do? You go on a keto diet. On a keto diet, all you do is eat fat, and the fat in your body burns away. So we load up with carbs. And this was so important to me that I wanted to make a unique formula that was specific for post-op patients that had to repair. It has protein. It has all the biotin, and it has all the other things that are necessary for healing. But we really wanted to load up on the carbs. So it's a high carb, not unlike the gainers that you may see for guys that are difficult gainers in their teens. They want to make gains or get swole on the off season in the wintertime. Similar to that, but it has all the nutrients that you need for surgery. And that's our Alpha Aesthetics, Alpha Nutrition whole line.
We got Steven as a team member writing in. What's the downtime for Gyno?
So it depends on what we do. So first stage, we just get into it. Very simple Gyno would be just making, just doing liposuction. So if we do liposuction, if it's mostly fatty, then I can just make 2 small nick incisions. We can even do it while you're awake. Put in a little tumescent, wait 10 minutes, and then go in with a liposuction and make sure that it's flush. Sometimes I may make a little nick incision and just pull a little bit of the residual fibrous portions through. That's our standard level 1 Gyno fix. And the downtime for that is about 2 weeks. 3 weeks for the gym, a week with the pads on to make sure everything's nice and flush and you heal nice and flush. And then another 2 weeks just for the garment that's hidden underneath your work clothes, and then you're ready to get go. But we do it differently. Instead of just doing the Gyno, at the same time, I can slide in, do a little body banking, and give you more cleavage up there and more upper volume. So if you have a little excess skin from the Gyno, instead of having to do some sort of skin removal, by doing a little body banking and raising the upper tissue envelope, I can make a better final result rather than the guy down the road who's just making that big incision and plucking out this big ball of Gyno of breast tissue and throwing it on the table for views on TikTok. We see there's a viral TikTok video that just basically shows making that big incision all the way, that smiley incision that nobody wants, taking out a big blob and throwing it across the table. Sure, he's got 5 million views or whatever, but what did he do? He gave a patient a big unnecessary scar. So when we do our Gyno fix, I make a tiny little nick that nobody is gonna see. The guy, one of my post-ops today, in fact, said, "Wow, I don't even see the stitch. It's so tiny, I don't need to put in a stitch because the skin to the nipple is right opposed, and there's no tension. It closes right up without any tension. So all I do is go in there, pull out tiny little strips, do a little bit of liposuction, make sure it's nice and flush. We put on the gauze, put on the foam and the binder, and you look like $1 million. And guess what? A lot of those Gyno factories, they show all the post-ops. They show all the pre-ops. They show all the post-op or the surgery videos. But how many post-op videos do they show? Because if you flex, they're going to get some kind of tethering from that big incision. And God forbid if that becomes hypertrophic scar or a keloid scar, it's going to be very obvious at the pool on the beach. If you have a tendency or are prone to having a keloid, the last thing you want to do is make a long incision. So with our Gyno Fix, we can, for 90% of our patients, we can go right through the nipple through a tiny little nick. And even if it does have a little hypertrophic element, it's just going to look like part of your nipple. You're not going to see it, and it's going to save you from having a big, obvious scar that, hey, you didn't want to take off your shirt on the beach because you had Gyno. Now you don't want to take off the beach because the doctor did an unnecessary a smiley face for just Gyno.
So now, a question we get a lot lately. Atlanta seems to be a hot area for male plastic surgery. So Xerxes asked, what does a patient have to do to utilize your services in Atlanta? Currently, Dr. Steinbrech does not have an office in Atlanta. However, I've dropped the link below. Go to maleplasticsurgery.com. You could book a virtual consultation, and he's got the country covered. On the coast, he's got New York, West Coast, obviously Los Angeles, and in the center, Chicago, and eventually he'll be expanding even further. Sorry to give that away, but what I'm saying is right now you got 3 convenient locations, but Dr. Douglas does do virtual consultations. Doc, probably at this point, probably 30% are virtual, right? Because you have a lot out of the country.
Yeah, no, we have so many out of the country. So many people fly from Europe and from Asia to the West Coast, Europe to the East Coast, but really also all over the country. And from Atlanta, a lot of our Atlanta guys go to the Chicago office. A lot of our Atlanta guys come to the New York office. The biggest booming places in the United States, I would say, is the places that everybody knows. People are moving to Nashville, to Austin. People are moving to Atlanta in swarms. And these are the big, when we look at our consults, they reflect this. We're seeing more people from those areas, from San Antonio, from those areas where the population is just booming.
Yeah. So I was going to put you on the spot asking you for the other spots, but I won't do that to you yet. So, all right. So we're going to get some cases. We're going to talk a little gynecomastia and or male breast reduction. I love this case. I kind of wanted to hone on this one. I noticed, you didn't just suck it out and throw it out like you talked about, but you actually kind of sculpted and give this guy a really nice chest. If you could walk through this case a little bit, if you don't mind, Doc.
Yeah. So this is a guy that we did some body banking as well. And that you can see that this is what separates us from a lot of other places that just do the gyno. So we not just look at the gyno, we want to get a whole better result for the entire aesthetic unit. That's the entire pec. So it's got the lower pole where the gyno is, but it also has upper pole. Like I said, you're going to have some excess skin being stretched out from the gyno. So not only do we want to do that, but we want to fill up the tissue envelope. And also, while you're there, while you're in the OR, why don't we make your entire chest look better? And if people have something else to look at that's nice, then they're gonna not notice the gyno all the more, and the gyno is going to be gone. That's the other thing. Yeah. So I can get a much better result instead of just bumping it to first base, a bunt to first base. I can do a double or a triple or a home run if I can put in a pec implant to increase more upper pole volume if the patient doesn't have any cells for body banking, or a pec implant and using some body banking for the greater inner central cleavage. I love when you show the gallery because it really shows the depth and the breadth of all the surgery we do. Because you can really get on our website and you can go into any tiny little area that most websites would only have maybe one picture or no pictures for, and you're just going to be able to scroll down forever and see all the different patients, and you can see a little bit of variety because we don't like to just cut and paste or show the same patients. We show big patients, little patients, bodybuilders, slender guys, runners, dads, grandpas, and youngsters. So we want to have people of different colors, every kind of skin tone. We want to have as great of variety in terms of the types of where you're starting from, so that virtually anybody can sign on our website for any given procedure and see somebody that looks like them to get a good idea and a realistic expectation of what they can look like post-operatively. This is a patient that we put a pec implant for. Just review a pec implant, one incision. Yeah. That's what I call the Ziploc incision, because other guys put in implants that put in 4 different incisions for the bicep, the tricep, the lat, the shoulder, the pec. I only do one incision. I can get bicep, tricep, shoulder, and pec. That's why we call it the Ziploc incision, because we just keep it open and shutting the same one. This guy has no scars. He has no scar around his areola. He has a tiny little nick to get the gyno out. So no visible incisions. When I started out, I used to look at everyone's galleries if they were doing some kind of gyno. Everybody has the telltale incision. There's a poke here and a poke here. And you can see clearly where some surgeon just took a place right directly on the chest and made a scar and inserted this liposuction cannula. And then they even did worse. They went in and made a big incision and pull out a big blob of fat. You don't need to do that. There are some times where I do that circumareolar incision. That's for what we call pectopexy, where someone has a lot of excess skin after massive weight loss, and we're trying to avoid making that longer infrapectoral incision. And there are ways that we can cheat the system by doing a lateral chest lift in concert with taking out a ring of tissue around the areola with the skin. I will do that in select patients that have a favorable skin type, so that they won't have hypertrophic scarring, and it really saves a lot of people from having to make a big scar underneath the chest. This is another patient. Oh, go ahead.
Real quick. I just want to give a comment. So this will be the final one of the night. And for those who want to check out more, go to maleplasticsurgery.com. You get 100 guys in the chat right now. A lot of guys are shy about chatting publicly. No worries. We get a lot of emails afterwards. We get a lot of inquiries afterwards. So Dr. Steinbrech and his team feels it. I would just want to give a comment before you jump in on this one, Doc. A lot of times you talk about these big, like, transformational changes, these big oohs and ahs for before and afters. I look at this and I look at the guy to the left and I'm like, damn, I wish I was him, right? But you made some tweaks and it makes like a world of a difference. So just walk through how you approach this one.
Yeah, so this is a guy that, he's just starting to get that kind of that dad bod, had done a round of steroids, so he had the gyno, but then he stopped the steroids and all the muscle deflated a little bit. But he wanted to, and he didn't have as much time to go to the gym. So what we wanted to do is help clean him up. And so what we did is centrally in the lower abdomen, he had that pocket of fat. Hey, thanks, Lixie. And if I just do regular liposuction on that central area of fat on his belly, 2 things are going to happen. First, he's still going to have some excess skin that's going to kind of hang, and he's still going to have that donut. So we learned if we start breaking it up by doing abdominal sculpting and maybe even highlights, that gives the eye something different to look at, and that can help reduce that donut that people have. So I don't really do the abdominal highlights, and I don't really do the abdominal sculpting to make everyone look like Adonis. It does make people look like Adonis, but what I really do is like to make it look more subtle. But the reason why I do it is to break things up so people don't just see that donut around the belly button after they've had the surgery with traditional old-fashioned liposuction of the belly. And then the other thing for him is we took out all that fat and took out that fat from the flanks, and we plugged it all into the upper inner chest and took out his gyno. So he had that beautiful upper pull volume and that great definition that you can see on the right side without the lower pull extra gyno that he had preoperatively. Patients are very happy.
Love it. Doc, as always, you give up your valuable time to do these weekly lives. You've been consistent with them. We're starting to build up steam. I think with one of our better numbers tonight. We got some great contributions. Go to maleplasticsurgery.com. Doc, I'll have you give the closing remarks.
All right. Thanks so much. Yeah, I was telling Tom that I could talk until morning about gyno. And we just talked about the very first level. We do a lot of chest lifts for massive weight loss. You got to go on to our YouTube channel and see the latest. Also TikTok and Male Plastic Surgery, which are our Instagram, where we have the latest killer video that's representative of people who have lost weight with Ozempic and the kind of chest lift that they can have. So we're seeing just more and more and more of that. I think over the last 2 weeks, we had 8 consults that were specifically, in addition to everything else, but specifically just for chest. is becoming more and more common. People are starting to see the kind of results that we can get on our gallery, and we're just seeing more and more and more of it. Thanks, Tom. I really appreciate it tonight.
My pleasure. I dropped the link to the video library below. Dr. Steinbrech, thanks so much for your time. Everybody have a fantastic week.
Absolutely.